Dear colleagues and friends, it's good to have you here. What I'm going to be speaking about is more on the basis of the role that Oncothermia plays in a new paradigm. This new paradigm is like Professor Dinos mentioned. It's a holistic approach. It's an integrative approach. And there are many things that we need to understand and do in order to be able to establish and promote this new approach. We are trying through the Hellenic Society for Integrative Oncology to establish and inform both doctors here in the Balkans and elsewhere about the need to approach the patient and the disease in a different way. Now, this is something that Zoran has helped me because he's already showed some of the things that I have, and Andras has already said some of the things, so I'll be able to run through this a little bit quicker. You've seen this, and this is basically the essence of the philosophy that we're discussing. Now, what I would like you to see, we've said what integrative medicine is, and this is basically what it is, but what is important is for you to understand that this is not just wishful thinking on Andras's part and on my part and on Dinos's part. This is something that is already taking flesh and bones. And the proof of this is the fact that down here, you see this is established already in the United States. It's a consortium of academic health centers, basically universities, for integrative medicine. And we're branching off for integrative oncology. Now, what does this mean? This means, in Greek, for those of you who are here from what I see in Greece, is κοινοπραξία ουσιαστικά πανεπιστημιακών κέντρων για την ολιστική ή ολοκληρωμένη ιατρική. The Microsoft, we had a little bit when creating the society an issue as far as what we're going to call it. We decided in Greek to call it εξατομικευμένη ογκολογία. Microsoft comes out with the interpretation and says the translation is ολοκληρωμένη. But that gives an indication that some people might not like saying that, okay, we're not doing a good job and you're doing a good job. So we just kept it to personalized, basically, integrative. Now, this is what I'm talking about. This organization is Kaksim. And you'll be very surprised to see who the members of Kaksim are. These universities, Duke's, Harvard, Mayo Clinic, Stanford, all these universities now have integrative medicine and are teaching integrative medicine. So you see, this is not wishful thinking on our part. This is something that is already moving. And we are trying to take this momentum and bring Greece up to the level that it should be, because let's not forget, all these ideas, as you saw before, were born here in Greece. So we need to come up to speed. Now, again, I'm not going to go into all of this because we already discussed this. This is the mission statement, basically. This is just to give you an indication of the fact that there are already requests from many universities to have an incorporation of complementary therapies into medical school curricula. And this is all across North America. It's also including Canada. So, this is something you've already seen. I'm not going to go into it. Basically, integrative medicine combines. See, that's the difference. We say that what is integrative medicine and why not alternative? The difference is that Mainstream medicine does not accept alternative medicine. Alternative medicine does not accept mainstream medicine. What we're trying to do here is take the best from both that has evidence that it works. And so that's the difference between integrative medicine. Now, this you've already seen from Zoran. So basically, if we push enough, it's just a matter of time. As you see, there are already publications requesting and demanding people to focus on medicine in an integrative way. So it's basically just a matter of time before we see happy cancer patients. This patient had 11 years of breast cancer and 2 years survivor of pancreatic cancer. So this is what Andras was talking about. We're talking about quality of life because it's very important. This is the primary purpose, increasing the quality of life, and then fighting for as much time as we can get. Now, this is what we have to do. We have to cross the chasm from protocol-centered medicine to patient-centered treatments. It's like Andras said, it's like Zoran said before. We have to shift the paradigm in the proper way. And it's difficult. In order to do that, we have to cross the chasm. Now, what I was saying before, there are already applications for research in the field of integrative medicine and for residencies in various universities all over the United States. I'm just showing you a few of them. Now, this is not very good, but anyway, these are websites that you can see that Sloan Kettering Memorial and MD Anderson Cancer Center, they've already established. These are with the bastions of conservative oncology, and they've already established, they began establishing units and departments for integrative oncology. MD Anderson had an issue, it opened, it closed, and now it reopened again. I don't know exactly what happened there, but because I was there, I can imagine. Now, integrative oncology has passed through several phases. I started working on this concept somewhere around here. I'd like to think that we're somewhere over here right now. And eventually the butterfly will fly. We need to keep that in mind. Now, the role that hyperthermia plays in this context is a strategical role because it is actually proven itself to be the fourth pillar of oncology. Like Andras said, it's something in itself that evolves. It's not static. And like Andras mentioned, the first case was treated 5,000 years ago. So we have evidence so many years ago, heat was used and applied to treat diseases. And then again in 1866, Coley developed a vaccine which caused fever. And we saw complete remissions in sarcomas. Now, it's not easy to get a new idea through. We know that. It's actually very difficult because let's not forget, even Galileo was ready to be strung up and burned because he came out and dared to say that the earth is round and it's spinning around. So we know, and we're fighting an uphill battle, but somebody has to do it. But it's important that we remember that new ideas don't die easily because you can delay progress, but you cannot stop it. So, now, what is hyperthermia called upon to solve? It's called upon to solve the issue that worldwide, taking all the cancers, the overall response in solid tumors to chemotherapy is 30%. Now, this is not me saying this. This is De Vita, who was considered to be the Pope of oncology. He says this, and I agree with him because that's my experience too, and that's why I had to look for answers and better approaches to treating patients. Now, we saw this slide. We don't have to go over this. Future trends in research in hyperthermia also involve nanoparticles and biologicals and many other things. Won't go into a lot of detail. Now, I want you to get you've seen patients before, but I want you to understand what the difference is when hyperthermia comes one-on-one with cancer cells. On the left, you'll see that these are all cancer cells. These are cultures, live cancer cells. In the middle, we have simple hyperthermia. And on the far right, we have what Andras was showing us, Oncothermia. This is the effect, nothing else, no chemotherapy, nothing. This is the simple effect of heat and of modulated electrical hyperthermia on the cancer cells, almost completely eradicated. Now, we know, as Andras showed us, we can do it together with hyperthermia and with chemotherapy and with radiation therapy. There are patients and there are phase 2 trials, so far no phase 3 trials, which clarify, and because a lot of times they ask, well, how do we know that when you're doing it together that it's not the chemotherapy or not the radiotherapy that's actually doing the job? Well, there's a lot of patients, and as you see right here, we're talking about hyperthermia alone in clinical studies, giving overall 49% response rate and 13% complete responses. So I think this is very significant. There's no question about the actual role that hyperthermia plays. Now, we know, like I said before, we can do hyperthermia with various modalities. That includes gene therapies. That includes biological therapies. Dendritic cells, like we said before, and Zoran showed you one of the protocols we're doing with Biomed and with RGCC. Vitamin C. We know that vitamin C in high doses can act like a chemotherapeutical agent. When it's combined with hyperthermia, the impact of vitamin C is very significant. We have presentations in the European Congress in Athens as well with very, very important response rates, and this happens to be from Japan. Here we go again with all the conventional methods, the combinations. Now, there's a change of emphasis also in cancer research because of the fact that all over there's more and more interest in the role that hyperthermia plays. Research itself is focusing on combinations. Now, we were discussing with Andras yesterday about the fact that liquid biopsies give us another advantage to be able to have full molecular profiles of cancer cells, thus exposing their resistance mechanisms as well as their sensitivities. And they've made a fleeting image of a completely targeted therapies a reality now. It's not just theory, it's reality. More and more research into biological and natural agents have enabled less toxic approaches when combined with hyperthermia, and even more so with electrohyperthermia. I won't go over this. We're talking about the liquid biopsies. These are the various methods that you can use, whether they're PCR-based, flow cytometry, bead-based method, gradients. Won't go into that. Anyway, I'll just quickly go over patients. This is a patient with intrahepatic bile duct carcinoma, inoperable. Whoops. And this is basically a patient that had complete remission with Oncothermia. Examples before and after, like you've seen. So this is an impressive one of liver metastasis that has disappeared. So it's important for us to know that in order to improve this status quo, we need to make the jump. We need to take the leap. If we just talk about it, we'll just be staying in the same place. But we, at least who know what we want to do, have to have the courage to do it. So integrative oncology is the difficult but right path. And I love Robert Frost when he said, 2 roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. So let's watch the sun rise and enjoy the dawning of a new age in medicine. Thank you.